Hey everyone, I'm Dr. Ross. Today I'm going to discuss with you a very sensitive topic, erectile dysfunction. Now this is a topic that would make any man nervous, and to be honest, it would make me nervous. That's because it's a very sensitive and personal issue if you have it that can potentially be embarrassing. Now most men want to achieve this, okay, when they have sex, and who can blame them? But I want to point out, and you might find this surprising, that nearly 18 million men over the age of 20 have some form of erectile dysfunction, with as many as 40% having some issue before the age of 40. So there is this misconception that you have to be 65 and above to have erectile dysfunction. That is not the case. And that's why I'm here today, because I want to break down what erectile dysfunction is, what causes it, and what we can do to prevent it. Erectile dysfunction is defined as the inability to maintain an erection firm enough to have sex. Now, before I discuss why we get erectile dysfunction, let's discuss normal physiology of how you first achieve an erection. Now, when you get aroused, your brain sends chemical messages to your penis to open and dilate the blood chambers. This allows blood to flow in, okay? And the pressure builds up to the point where the blood gets stuck in the chambers of the penis. That's the point at which you ultimately achieve an erection. But if the blood flow to the penis is insufficient, or if the blood fails to stay in the blood chambers of the penis, you will then have some form of erectile dysfunction. There are two causes of erectile dysfunction, psychological and physical. Now, most of you listening to this video are going to be millennials, Generation X, or Y. So you're most likely going to be affected by the psychological causes of erectile dysfunction. If you are coping with anxiety, stress, or depression, these can negatively impact your ability to achieve an erection. Now, the physical causes of erectile dysfunction have to do with circulation and blood pressure. So commonly, if you have a chronic disease like heart disease, diabetes, high cholesterol, these are causes that can affect your ability to have proper blood flow to your penis. This condition can affect your self-esteem, your confidence, and potentially impact your relationship. But luckily, there are options that we can explore together. First and foremost, lifestyle changes are going to be vitally important, so proper diet and exercise. This is going to be especially important if you're coping with the psychological causes of erectile dysfunction. Psychotherapy is also a great option. It's going to help you boost your confidence. And then of course, sildenafil, or better known as Viagra, which I'm sure you've heard of, will help to stimulate blood flow to your penis. When choosing an erectile dysfunction treatment, you should take your time because there are many alternatives out there. I hope you found this video informative. If you did, please leave your questions and comments below, subscribe to our channel, and as always, stay healthy.